138 more people have died in the last day. We are near 4,000 deaths in the state. But not everybody in that group tested positive for COVID-19. In fact, our Target 3 investigators found some of those who died actually tested negative. WC93's Mark Maxwell has details.
The first COVID-19 related death in Illinois. 3 more deaths.
13 additional deaths.
53. 125.
192 were reported in the last 24 hours.
As Illinois' daily COVID-19 death toll continues to rise, so do questions about the accuracy of those numbers.
I know some people have had concerns about the number of COVID-19 deaths that have been reported. Some are concerned that the numbers are inflated.
Public Health Director Dr. Ngozi Ezike addressed those concerns Tuesday.
At IDPH, trying to remove those obvious cases.
She says if someone tests positive for COVID-19 but dies in a car crash or shot to death, the state removes that person from the death count. What's harder to determine is the precise cause of death for patients with coronavirus and cancer or lung disease or some other underlying condition.
That there are no clear black or white answers. Everything is in shades of gray.
That gray area is where coroners come in and in many cases give their best opinion, even when hard facts are hard to come by.
Then this section here is the cause of death section.
CDC instructions list 3 categories on a death certificate: immediate cause, underlying causes, and other significant conditions contributing to death. Champaign County Coroner Dwayne Northrup says all 3 categories are technically considered COVID-related deaths.
Probable or presumed, if that's listed on the death certificate, a lot of times that's because the person had symptoms that were consistent with COVID-19, like a fever, cough, but the person was not able to be tested before they died.
You can put probable COVID on something that looks like COVID.
In McLean County, Coroner Kathy Yoder saw one case where symptoms looked similar to the coronavirus, but when the patient was still alive,
his test came back negative.
And after he died,
Dr. Denton and I, who's my forensic pathologist, we discussed this, and he was the one who wrote down probable COVID and said this is what I would go with.
That patient tested negative for COVID-19, but still wound up in the state's overall death toll, raising the question, how many other patients might have also tested negative or never taken a test at all?
A lot of the deaths are being certified by the physicians in the hospital.
Pulmonary specialist Dr. Manjeshwar Prabhu treats patients with lung problems at St. John's Hospital.
How do you know that patient died of the coronavirus?
We don't. We don't actually know that that patient died of coronavirus, which is why they've got a sort of a subclassification called a COVID-related death.
He says even if medical experts don't quite know how patients with coronavirus die or precisely what kills them, they know patients are in fact dying, and the coronavirus plays a major role.
Oxygen is really the fuel for our body. So without good oxygen, your heart doesn't work right, your blood pressure doesn't work properly, the brain doesn't work properly.
That was Mark Maxwell reporting for us. We asked the Public Health Department how many of the 3,900 deaths in Illinois actually tested positive, or how many were based on assumptions from doctors or coroners. They have not yet responded. Dr. Ezike has said more than 90% of those deaths also had other underlying conditions.